This podcast is about dermatoscopy of lesions with radial lines of pseudopods. Radial lines of pseudopods usually appear at the periphery of a lesion and usually in conjunction with another pattern. Here we have possible patterns formed by lines, and you can see that radial lines are one possible pattern. You can also see that there is a structural center, and you can also see that there are radial lines that are distributed over the entire circumference, which is typical for the so-called starburst pattern. Here we have the same pattern, but now with pseudopods. You also see here structural center, which is typical for these types of lesions. Now, before we start and before we go into the details, we have to clarify some issues related to terminology. What in the metaphorical language is called a starburst pattern in the language of pattern analysis is equivalent to radial lines of pseudopods that are found over the entire circumference of a lesion. Here you can see a Reed's nevus typically with a structural center and with radial lines over the entire circumference of the lesion. So overall the lesion looks symmetrical. Radial streaming or peripheral streaks in the language of pattern analysis are also radial lines, but now not distributed over the entire circumference. They are distributed only in some segments. Here you see a melanoma, and you can see radial lines in this segment, but not in other segments. So this gives the lesion an asymmetric appearance. Spoke wheel areas. Spoke wheel areas are is a metaphoric term, and in the language of pattern analysis means there are radial lines, but they're converging to a central dot or clot. Here you can see radial lines of pseudopods converging to a central dot. This structure is typical for basal cell carcinoma. It resembles vaguely a spoke wheel, but it's not necessary to use this metaphoric term. We can also say radial lines converging to a central dot. What are maple leaf-like areas? Maple leaf-like areas are also radial lines, but they are connected at a common base. Usually they are thick. They are also typical for basal cell carcinoma. Here you can see a typical example, and you see radial lines at the periphery, but they are connected at a common base, which vaguely resembles a leaf. Now, the diagnosis of most lesions with radial lines of pseudopods is easy. We have only to make a difference between radial lines of pseudopods that are distributed over the entire circumference, so circumferential radial lines of pseudopods. Then we usually have a Reed nevus. Or radial lines of pseudopods that are distributed only in some segments at the periphery. Then we have segmental radial lines of pseudopods. Then the differential diagnosis is melanoma versus basal cell carcinoma. Also, the differential diagnosis includes recurrent nevus, but usually the context tells you if a recurrent nevus is present. So this is a lesion with pseudopods. They are distributed over the entire circumference. So circumferential pseudopods or starburst pattern typical for Reed's nevus. Here we have a small lesion. We also have pseudopods here and here, but they are not distributed over the entire circumference. They can be found only in some segments, so segmental pseudopods, which is typical for melanoma. Of course you have to be careful. Sometimes it's not so easy to differentiate between segmental and circumferential pseudopods or radial lines. You also have to interpret the lesions in the context. This is a lesion with circumferential pseudopods in a child. In a child it usually is a Reed's nevus. Here we have pseudopods that can be found over the entire circumference, almost, but it's difficult to tell the difference. But this is a lesion in an adult, so it most likely represents a melanoma. Dermatoscopy always has to be interpreted in the context, and the context is the clinical context, including age, anatomic site, and other criteria. What about segmental radial lines of pseudopods? As I already said, it could be melanoma or basal cell carcinoma mainly. Here we have a chaotic lesion, we have a structuralist pattern, but also some radial lines in some segments, and as you can see here, they are connected at a common base, and the radial lines here are thick and vaguely look like a leaf. But it's not necessary to use this metaphoric term. We can call it radial lines at the periphery in some segments, and the differential diagnosis is melanoma versus BCC. Now, why is this a BCC? Because there are other clues to BCC. Which clues? Blood, which means ulceration, and blue clots, which are more common in BCC than in melanoma. Here is a chaotic lesion with what? With radial lines at the periphery. The differential diagnosis is melanoma versus BCC. What speaks for BCC? Of course, the vessels, because they are serpentine, and the blue clots, again, is more in line with BCC than with melanoma. This is also BCC, and we see radial lines at the periphery in some segments, not over the entire circumference, so the lesion is asymmetric, and some radial lines are connected at a common base, and we also have some vessels that are serpentine, which is in line with a BCC. Well, there are exceptions and there are cliches. What are the exceptions? Already talked about recurrent nevi. Recurrent nevi may also have radial lines at the periphery, and usually only in some segments, rarely over the entire circumference. But again, recurrent nevi are usually diagnosed with certainty because of the clinical context, but also the dermatoscopic context is that of a recurrent nevus. What is the dermatoscopic context? Here we see at the periphery a structureless white zone, which is the scar, and this lesion grows within the scar. Of course, the clinical context, the history of a shave biopsy of a melanocytic lesion in the past is also very important. Here is another recurrent nevus, and you can see pseudopods or radial lines at the periphery, only in some segments, and again you can see the scar at the periphery, which makes the diagnosis of recurrent nevus, also of course the clinical history. And where's a cliché? Here is what? Here is a chaotic lesion with a reticular pattern, and it could be a melanoma, and when we look here very closely, you can see that there are some pseudopods at the periphery in some segments, but it's not a melanoma. What is it? It's an unusual seborrheic keratosis. So even seborrheic keratosis can sometimes have, very rarely of course, so-called pseudopods. But we can make the diagnosis of seborrheic keratosis because of the sharply demarcated scallop border. There's another interesting finding. We can obviously see a pigment network here. So reticular lines or pigment network does not necessarily mean that this is a melanocytic lesion. Whenever you want to become an expert in dermatoscopy, you have to avoid cliches.